All right. Basic eye protection is something that a lot of people forget. We see people in the clinic all the time that have major eye injuries that could be easily prevented by wearing eye protection. I can think of a few examples just in the past couple weeks of people coming in the clinic that were grinding and they weren't wearing safety glasses and a piece of metal got in their eye. 2 patients just in the past week. If they were wearing an eye shield or safety glasses, it's very likely that no damage would have occurred and they wouldn't have had to come into the clinic. Even something as simple as wearing safety glasses when doing your yard work is very important. I had a patient just a few weeks ago who was trimming and a piece of some sort of plant got into his eye. He had a very extreme allergic reaction. Eye was very swollen. He came in very uncomfortable. It was easy to take care of with eye drops, but it could have been just as easily prevented if he just would have been wearing safety glasses in the first place. So remember, anytime you're using power equipment, be it a lawnmower, weed eater, grinding at home, even using a hammer, nailing something into the wall, good idea to just get a basic pair of safety glasses to protect your eyes. Also, when you're outside, riding your bike, you're riding at a high speed. There's a lot of bugs in the air, as we know at this time of year, lots of mosquitoes. Wearing sunglasses definitely helps protect the eyes from something getting in there and causing a lot of problem. And another thing on the bottom of the slide, it's talking about how safety glasses need to be made of a certain material in order to, be the proper safety glasses. You don't want safety glasses made out of glass. They could, easily shatter if something hits it. So make sure they're made out of a lightweight, impact-resistant material. Polycarbonate is the most basic. Trivex is a newer material. But most of the safety glasses that you'll find basic at a hardware store or something like that will be made out of a good plastic that's shatter resistant. Another thing that people complain about quite often in the clinic is their eyes bothering them and a lot of eye strain. As everybody knows, pretty much everybody works on the computer constantly nowadays. This actually causes a lot of problems. First of all, when we look at the computer screen, we tend to stare, not blink as much. This dries out the eyes. Second of all, it's causing us to a lot of strain because we're having to focus on the letters on the screen. And basic bifocals or basic glasses aren't necessarily good for long-term computer work because the computer is at a little bit further distance away from you than reading material. So you need a different level of magnification in order to see that computer print clearly. So sometimes rearranging your workstation so you can bring the screen closer to you, to your reading distance, kind of helps with the eye strain. But if you can't do that and you're working at the computer for long periods of time, 8, 10 hours a day, sometimes a specific pair of glasses just for the workstation is a good solution to the problem. These glasses you put on, when you look through the top, you see perfect for the computer distance. You just leave them at your workstation when you get up and walk around. Provides a lot of help for people that have to do detailed computer work for long periods of time. Contact lenses they're very helpful for most people. Most people see very well out of contacts. Most people don't have any trouble with pain or discomfort, and they see very well. But we do see some problems with contacts when people don't take care of them correctly. One of the main things people don't do is they don't wash their hands before they put their contacts in or take them out. It seems basic that you're going to be putting a piece of plastic in your eye. You want to make sure that your finger's nice and clean when you take it out, but sometimes we're in a hurry or we don't think anything's going to happen to us. Just taking that extra time to wash the hands definitely helps prevent infection and bacteria getting onto the contact lenses. Also, following the recommended wearing schedule is very important with the contacts. If you have contacts that you're only supposed to wear for 2 weeks and then throw away, not a good idea to extend them longer than that. But patients come in all the time that, say they wait till their contacts are bothering them until they throw them away. They'll be wearing a 2-week lens for 2 or 3 months. It's not a good idea. Additionally, sleeping in lenses is one of the main causes of major infections due to contacts. There are lenses approved to wear overnight, but even those lenses, I recommend taking them out as much as possible at night because your chance of infection still goes up with wearing them overnight. So remember, wash your hands, take the lenses out when you're supposed to. If your eye hurts, is very red or very painful when wearing contacts, take them out right away. Come see an eye doctor because if you do have some sort of infection, the earlier you get it treated, the less likely it is to cause a major problem with your vision in the future. So there's a lot of reasons why you should get regular eye exams. We recommend a yearly eye exam for everyone, regardless if you have vision problems or not. There's a lot of eye diseases that have no visual symptoms. One of them is glaucoma. Glaucoma is a disease where you lose peripheral vision due to changes in the optic nerve. The changes in peripheral vision are so far off in the peripheral vision that you're not going to know that you have a problem until it's too late. So coming in, getting your eye pressure checked, having your eyes dilated, having somebody look at your optic nerve is a reason to come see the eye doctor. A lot of people think they only need to see the eye doctor if they need glasses or don't see well. That's not the case. There's a lot of other reasons why it's important to see the eye doctor. Of course, if you do need glasses or contacts, you need to see an eye doctor every year. The reason we need to see you every year is because, of course, we want to monitor you for eye disease. And additionally, it's very common to have minor changes from year to year, and we just want to monitor that vision, make sure you're seeing the best you possibly can. And kind of as I was going in before, if you're having trouble seeing, most common cause of that is just a small change in the prescription. There's other reasons why you could also have trouble seeing related to the glasses. Glasses have a lot of coatings on them. Sometimes they wear off over time. If you're having problems with glare, there are coatings that you can have put on the lenses. There's one that's called anti-reflective coating that really helps people with night driving, glare off the headlights. It's something I always recommend for patients, as if they can only get one upgrade on their glasses, I would always recommend anti-reflective coating because it really helps with the glare issues. The slide right here is talking about low vision. Low vision is when people aren't able to see 20/20 basically, or see significantly worse than 20/20, usually due to some sort of trauma or macular degeneration. There are a lot of magnifiers and vision aids that can help people to see better functionally when they're in this situation. There's doctors out there called low vision specialists that specialize in showing people these different magnification systems and you getting them in contact with people that can provide them with these services. If you do not see well, don't think there's nothing an eye doctor can do. So if you've had poor vision for a long time, haven't been to the eye doctor, still a good idea to come in and have a regular eye exam because we may be able to refer you to one of these low vision specialists and they may be able to help you do some tasks and become more independent than you are now. And just like for the rest of your body, smoking is very bad for the eyes. It's been shown to increase the development of macular degeneration and cataracts, as well as contribute to dry eye. All the smoke coming in the air, coming in front of your face, getting into your eyes at all times. Causes a lot of people to have very red, irritated eyes. So we always recommend, just for your eyes, just like the rest of the body, quitting smoking. Any questions? Okay, we have a question here. It says, I've had 20/20 vision, but now I have to wear glasses for reading. What happened? This is something that happens all the time, usually to our patients that are right around 40, 38 to 42. Very, very common. Everybody over time loses the ability to focus their eyes. And the reason this happens is because of a process in the eye called presbyopia. So everybody eventually needs reading glasses, even if they see 20/20 at distance. They just need glasses to focus their eyes for them because their eyes aren't able to focus anymore for themselves. This is something that progresses over time and continues to get a little bit worse and worse. But with glasses, you should be able to see 20/20 up close in this situation.
So you need to show a screen. It should be shown.
Okay, here's another question. I use glasses when looking at the computer, but also have problem reading my cell phone. Is this normal? This definitely can be normal, and this is kind of what I was talking about earlier. Computer and reading material, like reading your cell phone, are at a different level of focus. Computer's farther away, and the cell phone is closer up, so they need different levels of magnification. We can't always have one pair of glasses that provides us perfect vision at all levels of focus. So if you're having trouble differentiating between the vision at computer and the cell phone, likely you might need two separate pairs or a progressive lens which provides different levels of focus for those different areas. Here's a very good question we have here. What is the difference between cataracts and glaucoma? This is very common. This is something that people get confused all the time. Cataracts are a cloud in the lens of your eye and cause you to have blurry vision over time. Generally, they don't cause permanent decreased vision. When cataracts get severe enough, they can be removed with surgery, and people can usually see very well after cataract surgery. Glaucoma is a progressive eye disease caused by changes in eye pressure and the optic nerve that causes a loss in peripheral vision first. Left untreated for a long time, it causes problems in central vision. Glaucoma is usually treated first with eye drops to lower the eye pressure. In very serious cases, surgery is used, but usually when people say their parents had some sort of eye surgery, it was for cataracts and not for glaucoma, but people get them confused all the time. Another great question here. What does it mean when you see black spots in space? This can mean a lot of things. If you see black spots that move with your eye movement, they could be vitreous floaters. In the back of our eye, we have a jelly-like substance that over time liquefies, pulls away from the back of the eye, and starts to move back and forth. This casts shadows on the back of the eye, which you see as black spots. This isn't too concerning unless you see them all of the sudden, especially associated with flashes of light. If you ever see flashes of light with an increase in the amount of floaters and changes in the vision, you should call and make an appointment to see an eye doctor right away, because it could mean that there may be some retinal problems going on. If you just see black spots only that have been there for a long time that move with your eye movement, most likely it's just vitreous floaters and not anything serious. Okay, another question. Doctor, why do our eyes get worse if we are wearing glasses? Is there something we are doing wrong? This is a very common question. A lot of people think that once we start wearing glasses, our eyes continue to get worse because we're getting reliant on glasses. This isn't true. Most of the time, when people first get glasses, they realize once they put the glasses on that they can see much clearer with their glasses. And then once they get used to that, when they take their glasses off, they think everything is really blurry, even though it's probably the same amount of blurriness it was before they got glasses. But since they're used to seeing clearly with the glasses, it's a big change in the vision. So it's more a psychological phenomenon than an actual eyes worsening thing. It's just now I see clearly with the glasses, so I'm used to it. And when I take the glasses off, everything seems really blurry. Okay, we have another question here. 56-year-old female states that doctors stated that they saw the beginning of cataracts in the exam. What should I do to slow the process? The one thing you can do to slow the progression of cataracts is wear sunglasses that block the UV when you go outside. UV light has been shown to increase the progression of cataracts over time, and if you protect the eyes from sunlight, it should decrease the likelihood that they will rapidly get worse. In general, cataracts worsen, but very slowly over time, but wearing sunglasses can help them to progress even slower. Another very common complaint here. Driving at night, the oncoming headlights make it difficult for me to see. Is there anything you can recommend to help this other than not driving at night? Well, there are a couple things that you can do to maybe prevent glare from the headlights. One is what I was talking about earlier with the coatings you can get on the glasses. There's a lot of coatings. The one that I recommended was called anti-reflective coating. Definitely helps cut down on the glare off of the oncoming headlights. If you were to get anti-reflective coating and you're still having glare problems, it could be from dry eye or possibly that you need a change in prescription or cataracts. So if the anti-glare coating does not solve the problem, I'd recommend coming in for another eye exam and getting things checked out. Okay, what can be done to prevent macular degeneration? This is a very good question. Nothing has really been shown to completely prevent macular degeneration from forming, but one of the main things you can do to help keep the eyes healthy as possible is having a proper diet. Lots of green leafy vegetables help the back of the eye. But getting regular eye exams is the main thing you can do to monitor macular degeneration. Somebody states they have problems wearing sunglasses because they make it too dark for them to see well. Any suggestions? The only possible suggestion that I would have is possibly looking for a different tint of sunglasses. You know, there are a lot of different tints. Even if they look very light, most sunglasses out on the market still will block UV light. You just look for a marking on the sunglasses, and it will tell you if they block UVA and UVB. Okay, another question. How old do you recommend children to get contacts? This is another very common question. There's no specific age requirement for wearing contacts. The way I look at it is it's more of a maturity level issue. You know, contacts are a medical device that you have to put in the eye and take care of, so, you know, we need to be very clean. We need to take them out when we should. We need to be able to, you know, determine when they're bothering me. Do I take them out? You know, some kids are very mature and they can do contacts as early as 11 or 12. Other kids, you know, especially boys maybe that are a little bit more dirty, you know, we have to up that by a couple years. But age isn't the most important thing. Maturity is the most important thing with contacts. Okay, another question here. Are the special vitamins sold for eye health, such as for macular degeneration, worth the cost? It depends on your situation there. The vitamins on the market for macular degeneration, which are made with the AREDS formula, have only been shown to prevent the progression of macular degeneration in patients who have a certain level of macular degeneration in the back of their eyes. They haven't been necessarily shown to be helpful for people who have no level of macular degeneration. So unless the eye vitamins are specifically recommended by your eye doctor, they may not be worth the cost. I would discuss it with your eye doctor at your next eye exam. I think one last question we're going to do here. Do you recommend LASIK for a 13-year-old? Doctors, at least in the U.S., do not do LASIK for patients usually under the age of 21. The reason for this is that the eyes continue to change over time. Usually the distance vision levels out pretty well around the early 20s. LASIK does not prevent the eye from continuing to become more nearsighted or farsighted. What it does is it sets the vision back to zero, basically. So if you were still going to change in the future, it doesn't prevent the change from happening just because you get the surgery. So that's why patients under the age of 21 usually aren't operated on for LASIK.
All right, thank you to everybody for tuning in today. If you did have any issues viewing the slides, you can give me an email and I'll shoot them over to you. It's Valerie, VALERIE, .Clifton, CLIFTON, at Kelsey-Seybold.com, and I'll be sure to send that on over to you. Also, make sure you join us next month. We're going to be talking about breast cancer. It's October. It's that time of year. Dr. Arlette Brown, our radiologist at one of our radiologists at Main Campus, is going to be presenting Think Pink for Breast Cancer Awareness Month. So be sure to go ahead and register at kelsey-seybold.com/webinars. Also, very special thank you to Dr. Wilkening for presenting with us today. So, all right, everyone, we'll see you next month.